All right, we are moving on to a very interesting, I noticed it this week, very interesting Sunday post. Typically, we share with you resources that we have, but this week was really to validate. There's a lot of validation going on this past week. Medical trauma um, that one might experience as a result of medical procedures, illnesses, hospital stays. All of these things can have lasting effects on us and can create what's called medical trauma. And according to Pain Scale, in an article titled "What to Do When Medical Trauma Interferes with Current Medical Care," the author shares the following. Medical trauma is an emotional response to a serious event involving medical care. So, for example, medical trauma can actually develop after an unpleasant treatment, a painful procedure, or hospitalization in the ICU. Medical trauma can occur when an error is made, such as when the wrong medication is prescribed, or maybe you even get a blood transfusion and it's the wrong type, or when a surgical mistake actually leads to a complication. Sometimes experiencing medical trauma or PTSD from a medically related event can actually be especially problematic because it can make us not want to go to the doctor anymore for your follow up. We might not trust taking medications. We might not want to ever have a procedure again, and just not agree to it. And that's actually not a good thing for our health, right? So here's some steps, 6 steps that you can take when trauma is actually interfering with your care and with your medical health. So number one, think about your appointment times. And Tammy on our board is one who definitely follows this all the time. She made a decision early on in her aortic disease recovery that instead of just allowing medical appointments to happen on a Monday, then a Tuesday, then a Thursday, Friday, and then the next week, Wednesday, Thursday, Friday, she said to herself, I allow myself 2 days out of the week. Those 2 days are my only days. I will always do my medical appointments. I don't want to ever do one on a Monday, typically surgical days for physicians. So she made a decision to say, these are the only days of the week I'm willing to see physicians, unless it's an emergency, because then she can wrap her brain around the fact that this is a medical day. It becomes like Pavlov's dog. Oh, it's a Thursday, must have doctor's appointments. What do I have? But Wednesdays, I don't have any ever. It's my play day, right? Or my watch my grandkids day. Involve a family member or a friend. She, as often as she can, has her mother go with her. Number one, it's good to have an extra set of ears because medical trauma can put us in a position where we are scatterbrained and our anxiety causes us not to really be able to pay attention. Having that extra set of ears there or hands to take notes, maybe even ask a question on your behalf because they're really interested or because they know you wanted to ask and you forgot. It's so beneficial. So consider bringing a family member or a friend. Be honest with your medical team. So one of the ways, and we're going to introduce this concept very soon, one of the ways you can ace your doctor's appointments, regardless if you suffer from medical trauma or not. The easiest way to ace a medical appointment, which means how to best advocate, communicate, and educate your physician or your clinical team, is to be honest and to tell them what your needs are and to tell them what you're feeling and to tell them what you're comfortable with and to educate them on what you're not comfortable with, to tell them this is how I work best. I ask all of my doctors, do you prefer me sending you an email in the portal, or would you like me to call and leave a message that I need to speak with you, or do you want me to reach you by cell phone? Because I have to have my doctor's cell phone numbers or I don't feel comfortable. That's me. That's a fair question. When I was working and you worked with different members in an organization, and as you meet these stakeholders, you might say, what is the best way for me to reach out to you? Do you want a phone call? Do you want an email? What do you want? What works best for you? Same thing. In order to ace these appointments and develop the best relationship that will give you potentially the best results and the highest quality of life, you have got to learn to advocate for yourself through proper communication and education of your physicians. And that's how you strengthen that relationship. That's going to help you combat your medical trauma. In addition, breathe, breathe. Try to breathe. These all sound sometimes like such silly things, but taking a minute to breathe, some tapping techniques. I like to swipe over my eyebrow. I don't tell many people I do it. I just kind of do it. if I'm really stressed or I'm about to walk into a stressful medical situation. And I've had a lot of therapy, but this is my grounding. This is my physical grounding technique. I'll sometimes breathe. I sometimes will have gum. So I'm tasting something, smelling something, and I'm feeling something, and I breathe. That brings me down a few notches. Um, and be willing to ask for help. There's a lot of therapeutic methods that will help you. When I have had to go to the ER for potential TIA or stroke, it's a rapid response team. There's like 5 or 6 different people being called in. You got somebody, blood pressure, and the thermometer, and the pulse ox, and the IV, and follow my finger. It's too many people. It's too many people. I have to just be honest and say one voice. If you all start talking to me, the anxiety that this will provoke will have me shut down, and then I actually find I can't speak. I The words are there. I'm completely coherent, but there's a disconnect and it won't come out of my mouth. And that could be partly due to a mini stroke, or it could be more than likely due to overwhelming anxiety. And my brain just says, we're just done here. I want to talk, but it doesn't come out. So I say to them as quickly as I can, one voice, one person, one movement. Too much movement, I'm out. I'm either going to pass out or I'm just going to disengage completely, and disassociate is what I'm doing. So I'm very upfront and I'm very honest, and I tell them what I need. And when I get a blood test, I'm very upfront and honest. I'm like, isn't it crazy how I can have my chest cut open, but you're going to stick this little baby needle, right? Because I have baby veins. So I need a baby needle like a butterfly, kind of tell them how to do their job. And I'm kind of nervous about it. So just bear with me. And I tell them, do not use a regular needle on me. I want a butterfly because I know my veins and you will be able to get that in better. You just have to say what your needs are. And we come from this world where we think that if we tell a physician what we need, that we are now deemed a problem person. We're deemed a Karen. I can say it because that's my name. We're deemed disrespectful. And I will tell you that from all the physicians I've spoken to, could not be farther from the truth. They want you to talk to them. They want you to tell them your needs. They don't know the best way to treat you unless you speak up for yourself. So we, again, are going to be drilling home ways that you can ace these doctor's appointments and combat your medical trauma through advocating for yourself via good, strong communication and proper education, and thus developing a relationship. And if you need to, just find a new doctor. When all else fails, you need to. Look, there's a lot of doctors out there, and sometimes you just need a different lid for the pot, right? It's just not going to work, and that's fair, and that is okay.